Hey everyone, this is Dr. Ben Thompson. I'm here with Dr. Cliff Olson of Applied Hearing Solutions, but you may know him more so for his popular YouTube channel. And we're here today to talk about tinnitus, his personal story with tinnitus, his journey as an audiologist, best practices for tinnitus management, as well as how to manage tinnitus when you have hearing loss as well. So, Dr. Cliff, welcome to the Treble Tinnitus Relief Podcast. Let's start by going back to what are the first signs of tinnitus that you experienced, and what is the cause of your tinnitus?
Yeah. So first time that I even realized that tinnitus was actually a thing, I was in Marine Corps boot camp. They had found a hearing loss in my right ear. And one of the questions that they asked me was, do you have any ringing in your ears? And I'm like, well, yeah. I mean, doesn't everybody, when you're in a quiet room, doesn't a quiet room just have a ring to it? And they're like, no, well, that's tinnitus. And that is not something that everybody has. And it had been something that I had experienced for several years. It was something that in a quiet room, I'm like, man, how can anyone stand being in a quiet room? Because, the quieter it is, the louder that it gets. And, I think that mine was probably caused by the hearing loss that I have in my right ear. I can't remember because we're talking probably 20 plus years ago. And I know that a lot of people have this instantaneous, I remember exactly when it started. But for me, I think it was more of like a gradual thing to where I just realized, okay, I've got this ringing that goes on in my ears and never knew that it even had a name. And so I was 19 years old before I realized that tinnitus was called tinnitus. And to be honest, I never knew I had a hearing loss up until that point as well. In fact, I know that when I went through all the process to get into the Marine Corps, they have you go through a medical screening and to identify, do you have hearing loss? And if they would have found that hearing loss during my screening process, I never would have even went in to boot camp.
Yeah. Wow. So eventually you become an audiologist and you not only learn about tinnitus, but the entire, profession of how do we help individuals with tinnitus and hearing loss. Tell us about the story of why you decided to create educational information about hearing loss and tinnitus. What was wrong? What was broken in the system that gave you this inspiration to create something to help others?
Yeah, so in 2017, when I first started the channel, if you went online and you Googled anything about hearing loss and tinnitus, you wouldn't really get that much information, and at least not that much accurate information based on the training that we had going through our audiology programs. And so I was like, I like watching other, vloggers on YouTube. I like watching other channels that are like informational channels where they're trying to kind of share information so I can make better informed decisions about a variety of different things in my life. And I'm like, what's really missing? What's missing is having an audiologist share information about what they know and the reasons behind everything that they know and how it impacts consumers. Because I didn't want, I think of patients who would come into my clinic at that time, because I opened up my clinic right around the same time. And people would come in and they would have no concept of anything about their hearing loss or their tinnitus. And I'm like, people just need more information. They need to be able to do more research because they go to certain clinics and they're not getting the information. They don't have time to spend with them, to educate them. So I'm like, why don't I just create videos that will live on forever? And if nobody cares about them, that's fine. I'll stop making videos after a year. But, fortunately, after a year of me making content around hearing loss and tinnitus, and ironically, my very first video ever that I posted on the channel was a tinnitus video talking about how there is no cure, but there's a lot of different treatments that you can do.
Let's talk about that because that message is so important. One thing that I've learned over the years of understanding what are people searching for on YouTube and Google is how many professionals look at tinnitus cure as a medication or a surgery to completely remove it. But the individuals who are searching for help with tinnitus are just looking for anything they can do to improve it or reduce it or possibly eliminate it. And there's sometimes this gap where people are searching for a cure, but then they end up finding that there are therapies and treatments and solutions that are available. But for 99% of people, it is not a surgery or a medication. How do you communicate this in relationship to what someone hears from their doctor, which might be dismissive or, take away their hope about getting help versus what's actually out there in terms of practical solutions and management strategies and treatments?
When it comes down to consumers looking for information, we'll start with that aspect. What I found on YouTube is that YouTube will give people what they're looking for. And so there is a heavy search query for cure for tinnitus, right? Or cures for tinnitus, or something around that terminology. And so that's why I felt literally for my first video that I need to like kind of lead people in with this idea, like that there is no like universal cure here, but there are things that you can do that can significantly improve your perception of tinnitus. Maybe for you, that's a complete cure by just, putting a hearing aid in your ear, or, running a fan, which is what I do at night so I can fall asleep, because I don't like to sleep in a dead silent room. So I run a fan, and that solves 90% of the difficulties that I have with my tinnitus. And so this idea of there being like no universal cure, I think it's kind of, infested our level of thinking as providers as well. And especially I would say like in the ENT realm, I get so many patients who come in who said, well, I went to my ENT and they said that there's no cure for tinnitus, so just get used to it. And I'm like, well, okay, like I agree that there's no universal cure, but that doesn't mean that we should be discounting all of the different potential treatment options that are out there.
Yeah. There's a lack of knowledge, there's a gap there, because what's missing is to say there's no cure, medication, or surgery that I have for you. However, here are 3 options for things you can do. And that creates the door, that opens the door for the individual to proceed, to work with the next specialist, to learn about the right information.
This is a short interruption from today's video to announce the tinnitus quiz. If you're watching this video, there's a good chance that you or someone you know has tinnitus. We know how much tinnitus can impact your daily life, and we're here to help. Visit tinnitusquiz.com and take a 2-minute quiz to receive personalized treatment plans that have helped hundreds of people learn to manage their tinnitus. Start now at tinnitusquiz.com.
Everyone here is watching is curious about you and your story. And we also like to learn about, how tinnitus affects each of our lives, because it is different. A few things that I've found helpful over time to explain tinnitus are, how does it affect you day to day? And then if you could put a number on it in terms of how much it bothers you or how loud it is, from 1 to 10, 10 being the very loudest, 1 being essentially nothing, how would you explain your tinnitus in layman's terms?
Yeah, so it's funny because it fluctuates. I would say that by and large, that my tinnitus bothers me when I'm in a quiet room, or when I am, I would say, stressed out, or when I've had a little bit of alcohol, right? It tends to increase my perception. And the more that I focus on it, the more that I dwell on it, the higher my level of annoyance goes. So I can go from a 2 on a daily basis. So like right now, I'd say I'm around a 1 or a 2. I am hearing it right now because we're talking about it and my mind's thinking about it. But if I were to, be dead silent inside of my YouTube room that has a lot of sound treatments in here, my tinnitus will go up to a 5, a 6, or a 7. And so I've really kind of augmented my life in a way to where I can ensure that I'm never in a situation where it gets up to that level, because I know how to address it. So for instance, if I'm traveling, I can always travel with one of my small sound generators. I can always travel with a pair of Bose sleep buds, things that I can do because for me, masking works. Like I love having masking. It doesn't take away the tinnitus, but it covers it up to the point where it doesn't really bother me. And I can take myself, if I really want to, from a 5 or a 6 down back to a 2 or a 1. And all I have to do is implement that one thing. But, I've tried like 7 different things, and I found the one thing that really works for me. And so that's the thing that I go to.
Yeah. Let's talk a bit about hearing loss. In your experience, after you review a hearing test, or after you help an individual make their next decision on what they should do about their tinnitus, what are your main talking points in regards to the relationship between tinnitus and hearing loss?
Yeah, so, one of the common theories out there with tinnitus is that if you have a hearing loss, that absence of sound making it from your ear up to your brain creates this phantom sound. Like your brain's like, hey, where's that sound I've heard my whole life? Can I please have it back? If you're not going to give it back to me, I'm going to turn on this ringing or buzzing sound inside of your head. And you'll perceive it as being, either central or one ear or the other ear, depending on where your hearing loss is at. And so, the idea of when someone is experiencing tinnitus, of course, and you want this all the time as well, where you want to see a hearing test so you can see if hearing loss is part of it, because not everybody who has tinnitus also has hearing loss. So that kind of goes into say, well, there's got to be something brain related that is causing that perception that you're having. Now, there's data out there that shows that 6 out of 10 individuals, when they experience tinnitus and they have hearing loss, and I believe it even works for some people who don't have hearing loss, if you use either a sound generator or a hearing aid that has been programmed to your prescription to replace the missing sound, 6 out of 10 individuals actually get a significant reduction, or even while they're wearing the hearing aids, a complete elimination of the perception of the tinnitus. And the other thing on top of that is that even if you don't get it to completely go away, that gives you a tool in your tool belt to implement different types of, sound therapies. So, and just the thought as an individual who has tinnitus that you could at any time, I've got this tool that I'm using, that I'm wearing on my ears, that I could implement something if I had to, that level of feeling of being a little bit in control of the tinnitus helps out a lot as well and can reduce down your perception of annoyance.
What you shared there is the sound therapy itself. Even if I did nothing else, the sound therapy itself can provide relief in the short term. And what we know as well is that it can help shift the baseline levels of tinnitus in some cases, not all, but in some cases. And what this shows us is the power of the brain to change, neuroplasticity, how tinnitus is a neurological symptom. It's not set in stone. Whereas we typically look at hearing loss as something that is set in stone. It's not going to get any better. So let's proceed with treatment via appropriately fit hearing aids that are matching the hearing test result and this prescription. We're now getting into really your specialty. And I feel like just what the world needed to hear clearly, which is that there is a preferred way to get help with hearing loss treatment. Let's now give you an opportunity to share what you've learned over these years of becoming the best practice audiologist and sharing about hearing loss and also its relationship to tinnitus.
Yeah, so let me actually go back to graduate school for this. So I went to University of Illinois, Urbana-Champaign, and I had some really good preceptors while I was going there that really helped me understand the value of one of the best practices, which is real ear measurement. So this is a way that we can verify if a hearing aid has been properly programmed to someone's hearing loss prescription. There's a lot of data out there that suggests that when you fit someone to a validated prescription using real ear measurement, that their performance outcomes are substantially better than individuals who are not, right? So that was instilled in me in grad school. So when I was looking for a fourth-year externship, which is actually what brought me out here to Arizona, the only places I would consider are the ones that at least did test box measures and real ear measurement. And so once I whittled down my options to that, I ended up going to one of them. And then I started, doing a lot more, research on what are all of the things that we should be doing to achieve high-level outcomes. Had the fortunate ability to go and hear a talk by Gus Mueller. And, he was talking about all the important aspects of following best practices. And he actually told me, he's like, Cliff, if you want to be a good audiologist, or actually, I think he said, if you want to be in the top 5% of audiologists, print out a set of best practice guidelines, follow them to a T, and you'll be in that top 5%. And so that resonated with me at that time period. And so when I was starting to create video content, I didn't really know what direction I wanted to go. I was throwing out different pieces of content out there. Some of it stuck, some of it didn't. I ended up publishing a video on real ear measurement, and that one actually took off, right? And I actually, I think I called that video the most important hearing aid video that you could ever watch, is what I titled it. And it was all about real ear measurement, because that was something that no consumer had any concept of at the time. And now you hear people regularly talking about, like, I want to find a provider who does real ear measurement. And then I started thinking, well, just because you do real ear measurement doesn't mean that you're going to have a good outcome. There's all these things that you need to do to have a high level outcome. So I'm like, I'm just going to start making video content talking about, you need to find someone who follows best practices. And AAA, so the American Academy of Audiology, had best practice guidelines that they published back in 2006. And I'm like, you know what? I'm going to create a checklist of all of these best practices. This is what I'm going to follow inside of my clinic to make sure my patients get a high level outcome. But it ended up turning into a thing where I get calls all over the country, emails from all over the country, I guess you could say world at this point, looking for someone who does things the way that I do them in my clinic. And because this best practice message is really what took hold on the channel. And so I didn't have anywhere to refer people. So I ended up creating a network called the Hearing Up Network. And then I basically vet these providers and say, hey, if you follow these best practices, you're committed to dispensing more than just one brand of device, because no one likes to be sold just one brand. I'm going to put you through this vetting process. And then on the other end of it, I'm going to be like, I feel comfortable referring people to you. And so this is really what my message is that whether it's with hearing loss, whether it's with tinnitus, there are certain foundational things that have been backed by research that your hearing care professional should be doing in order to achieve a high level outcome. And if they're not doing it, you're likely leaving a significant amount of benefit on the table.
Yeah. Let's zoom out. Let's go to the individual experience. Let's say I'm going to a restaurant. Let's say I'm with my family here. What's the functional real world difference? Let's just say, on average, between someone who goes to a clinic where they don't fit these hearing aids well, and they don't provide the right support and guidance, versus someone that does, let's say in the Hearing Up network, or another, talented audiologist that follows these best practices. Functionally speaking, what do you think the difference there is for the average person? Or is it or even if it's their family member that they're trying to talk to?
Yeah. So, when I talk about functional, I need to make sure that I contextualize it with data to some degree. So, because otherwise it just sounds like I'm just being like markety, right? Where I'm like, oh, it's substantially better when you go out, you can hear friends and family. Like, that's great. But we have to look at the data that's behind this, right? So Mike Valente published a study, and we'll just stick with, keep it singular, because best practices is all encompassing. It's a ton of things.
Yeah.
Let's stay singular with real ear measurement, since we talked about it already here a little bit. So he published a study in 2018 that had people compare their perception of benefit with hearing aids, the same hearing aid programmed to first fit, which is just like an auto program based on entering it in an audiogram, and real ear measurement. And 4 out of 5 individuals, it was 81% of individuals, preferred the real ear measurement fit of those devices. So just perceptually right out of the gate, they're like, this sounds better. I do better with these settings when they're set up with my hearing aids, when they're set up with real ear.
I can hear more clearly.
I can hear more clearly, right? I can function better in a variety of different situations, right? But if you go back even before that, 6 years to 2012, there was a study done comparing an old analog hearing aid. Who was this? This was Flexor, and I'm drawing a blank on the names. But this was a study done in 2012, and it was comparing an old analog hearing aid to modern technology. The old hearing aid was fit with real ear measurement. The old analog device, ancient device, was fit with real ear measurement. The new technology, the latest and the greatest, with all the features and customizations and auto adjusting capability, every single one of the modern hearing aids performed worse in a noisy environment when it wasn't set up with real ear measurement compared to the analog device. Now, once they did real ear measurement on the digital devices, those outperformed the analog hearing aid, right? So that shows us directly that if you go into a background noise situation, you're going to significantly improve your ability to hear in background noise if you have real ear measurement done. But I want to touch base on one other key aspect of this. Everybody has a signal to noise ratio loss, right? So inherently, like, how good are you at separating speech from background noise? If you have a really bad speech and noise score, then even if you're fit with the best hearing aid in the world, programmed perfectly with real ear measurement, you're going to still go into that background noise situation and struggle. And if that's the case, so another best practice is doing speech in noise testing during your hearing test. And if your provider identifies that you've got a high score, which is not a good thing on a speech and noise test, that you need to use an assistive listening device. So having that discussion is also the best practices.
Yeah. We're showing here that for many people who may have found you or may have found me by looking for something quick, something easy, something fast to help with their hearing loss, just a hearing aid online that can help me, or a quick tinnitus technique. We learn that these are comprehensive systems that interact with the ear, the nerve, the auditory brain. And when we take a holistic view at things, we can learn that it's more than just a widget. It's how that technology interfaces with our auditory system.
Yeah, here's the thing. I'm a big fan of people testing stuff out. Like, if you want to go and you want to buy an amplifier online or an OTC hearing aid, and you're like hoping that that's going to solve the problem, I hope it does. I hope you use it and you're like, oh my gosh, like my tinnitus is gone when I use this, or I can hear better in these situations. The thing that scares me is that people would try these things and they get no benefit from them. And they're like, see, I tried treatment. There's nothing that works. And it's like, that could not be further from the truth. So a lot time that I spend is saying, okay, like, you can try those things and I support that you try those things. But if and when it doesn't work, you need to take the next step. You need to get a professional involved.
Yeah. I want to bring up a point that another one of my colleagues explained to me, which I felt like is very helpful. It's that we have this continuum, let's say, from the first symptom of tinnitus into complete deafness, which is a very wide range, right? We're basically covering everyone's symptoms, everyone's medical history with ear-related, hearing, tinnitus-related things. So all the way from very first signs of tinnitus until hearing aids don't work for me, I need a cochlear implant, there are options. And having options is what gives us a sense of relief and control and improves our ability to be in quieter places, improves our conversations. So, this can be from some basic tools to manage tinnitus, sound therapy, some mental psychological techniques, up into more advanced sound therapy, potentially hearing aids. And then when hearing aids aren't enough, like you said, a remote listening device, something you might clip onto someone's shirt or on the table, an additional microphone that can improve our hearing. If hearing aids and that microphone don't work, then a cochlear implant surgery may be possible. This is something I wanted to introduce to you. I know this is not new to you, but introduce to our conversation to talk about how really anywhere along this journey, there are options.
That's totally true. So one of my pet peeves is when an audiology clinic will name themselves like we're whatever hearing loss and tinnitus center. And the only thing that they offer for tinnitus is a hearing aid. And I'm like, okay, well, there's a whole lot of things that you can do for tinnitus. And if your answer to every single case of tinnitus is, I'm just going to fit you with a hearing aid, there's something wrong here. Now, to be fair, if you're a clinic who's like, listen, I primarily work with hearing loss and that's my focus, but if you happen to have tinnitus, well, as I'm treating your hearing loss, you may get benefit with the hearing aid for your tinnitus, that's fine. But you're right. Like if you're going to be someone who is an expert with treating tinnitus, and it's so much so that it's in your name of your business, you go through the entire continuum of all of that stuff, right? Like starting off with, there can be, cognitive behavioral therapy. You can have, sound generators that are not hearing aids. You can have ear level sound generators. You can have hearing aids. You can progress your way up to cochlear implants and auditory brainstem implants and all of that stuff. But to really discuss that entire continuum, because everybody can fall into a different place, especially when there's tinnitus, and especially if there's no hearing loss along with the tinnitus. I mean, you're going to fit someone with, you're not going to fit someone with a cochlear implant who has no hearing loss and tinnitus just to get rid of the tinnitus. But you see my point here, right? Is that everybody needs to be somewhere along that journey, and what works for one person might not work for somebody else.
Yeah. Well, tinnitus and hearing loss are so related. There's so much overlap between the two. But what we both know is that people who are looking for help with hearing loss are going to search for hearing loss. People who are looking for help with tinnitus are going to search for tinnitus solutions. And part of us doing this collaboration here is, bringing these two YouTube channels, which are popular amongst individuals who have these conditions, together to share some insights. And now's the time where, for anyone who wants to learn more about what you do, Cliff, your contributions, as well as any offerings you have, now's the time where you can share that information to our listeners.
Oh boy. Okay. So I got the YouTube channel, obviously Dr. Cliff AUD, where I publish, multiple videos that are probably around 5 to 10 minutes a piece, a little bit longer when I do hearing aid review videos, which I do regularly on the channel as well. We also have Dr. Rachel Cook, who's publishing some content on there. So if you want to get, a different perspective than just the Dr. Cliff perspective on the channel, you can get that. We have the Dr. Cliff Show that is live every Wednesday at 4 p.m. Arizona time, where we do Q&A after the show is over as well. But we talk about a variety of different topics: hearing loss, hearing aids, cochlear implants, tinnitus, things like that. I also have the Hearing Up Network. These are a network of hearing care professionals who follow comprehensive best practices when treating adult hearing loss, not necessarily tinnitus. Some of them do specialize in tinnitus as well, but that is not the main focus of that particular network. You can find that on hearingup.com. And then hearingloss.com is a joint venture project that I'm working on with Audiology. We really want that to be a platform that people can go for a lot of information regarding hearing loss, vestibular, anything ear related. So tinnitus, of course, would be included in that. Pediatrics, which I don't focus on my regular channel, but you can go there as well. You can probably find me on LinkedIn. You can find me on TikTok. You can find me on, YouTube Shorts. You can find me on Instagram. If you do searching for @Dr. Cliff AUD, usually you can find me pretty easily.
Cliff Olson, thanks for being here, and I'll talk to you soon, my friend.
Thanks, Ben.